Well, good evening, everyone. This is Tustin Longevity Center, and we're here together with our TLC Health Freedom Tribe, and this is our weekly meeting at 6 o'clock every Tuesday night, where we invite you to ask questions about anything that you would like, general questions about your health or uh, the integrative functional questions you might have. And you can also email in a question. If you look at the bottom at the end, you can see a site to type in email questions that I get. I get them handed to me right before we go live, so I don't pre-read these. This is all new. I'll do my best to try and answer questions that come to me. This is not meant to be personal medical advice. This is general information, educational. And if you are a patient and you have a concern, please use our office protocol by calling in at 714-544-1521 and leave a question. And during our work hours, we'll get back with you. We are trying here to create a venue, a means by which you, your family, friends can see what a general response might be to a question you have on functional medicine, integrative medicine. How we here at Tustin Longevity Center, we have 7 physicians and healthcare providers. And altogether, we are trying to do standard medical care and also include the preventive background functional health care that has been performed for thousands of years and integrated into your whole process. And from that point, we'll start with questions from the email. I have a couple of pages here. We'll start with Patricia. Patricia types in and asks the question, hello, Dr. E. Hi, back to you, Patricia. What are your opinions on donating blood? Thank you. My opinions on donating blood. I'm in favor of supporting our blood bank for many reasons. There are people who have trauma, have surgeries, and so forth. So I'm all in favor of that. And I know there is some concern now with those that receive the mRNA injections, and there's concern about this. And I think it's reasonable. In fact, there are some organizations that are starting to develop that exclusively take the blood donations of people who did not receive those mRNA injections. So I'm all for people trying to help other people and the donation of their blood. So yes, I'm very much in favor. But it's nice how in a free enterprise that you can have some interesting entrepreneur start up their own company that is trying to cater to a special need in the population, those who may have a concern. And that's very interesting how the free enterprise system works. Patricia also types in, hello, Dr. E. My grandchildren are very active. Well, that's wonderful and typical. Okay, typically healthy kids that drink water all day and eat healthy, clean foods, and get good sleep. But they seem to get everything that's going around. What are your recommendations for keeping an 8-year-old boy and his 5-year-old sister healthy throughout the winter season? What supplements should they be on, and what other advice can you give us? Thank you so much for your kindness and consideration, Patricia. Well, as we're developing from our birth and throughout our lives, but most especially in our childhood, our toddler and our early grammar school years, this is how our immune system is learning about the world around us and the various exposures to the, hundreds and thousands of pathogens, viruses, bacteria, fungi. So a child should always probably be responding. And you can see this usually with maybe a little bit of a runny nose, occasional congestion, occasional cough, occasional sore throats. And it is just showing that their immune system is mounting a reaction. As long as that child is drinking and eating normally, is responsive, and appropriately is focused. If you say their name or you look at them and they track you, like with an infant that can't understand words necessarily, but they're tracking you, you know that they are alert and they are oriented to their best ability to their situation. If they're a little tiny, few weeks old, months old, to a toddler who recognizes their name and mommy and daddy and hugs and basic commandments. As long as the child is appropriate in that behavior aspect, drinking their water, and they're not having fevers that are very high, we tend not to try and over aggressively treat fevers in the children, because fevers are a natural way for the body to mount an immune response and produce certain uh, uh, biochemical molecules that fight off a invasion of a pathogen, and a fever facilitates that. So unless the fever is very high, low-grade temperatures we don't chase after. And now what will we do to try and keep them healthy? Well, just standard hygiene, washing your hands before eating, teaching them hygiene to brush their teeth and to blow their nose appropriately, things like that, of course. But as far as nutrients and items I have around my house for my grandchildren, I have Argentine silver. I have the mist spray, so you spray it, and you can literally spray the child's face. It's a game-like thing, and they get this nice antibacterial, antiviral, antifungal action that can help clean off this challenge. There's also the nasal spray. There's droppers that you can use, and they can take a teaspoon of it and gargle and swish and swallow is fine. So that works as kind of like a general antibacterial, fungal, virucidal. The other thing we encourage is to have supplemental vitamin D, because we're seeing vitamin D levels so low. But we also encourage you to have them see their doctor and get a blood level checked of how their serum vitamin D is running. Certain fat-soluble vitamins should be within a certain range. We tend to like a little higher range than the general recommendations. So we would certainly like them to be 60 to 80 micrograms per deciliter in their lab reports. And so a dropper that is usually out there has about 1,000 international units per drop. And so that would be probably very reasonable for the infants. Once a day, check their levels. For toddlers and grammar school, they can probably have 2 drops or 2,000 international units a day. When they become older children, 7, 8, 9, 10 years old, then you can start giving them 2,500, and then junior high schoolers should probably be around 5,000 international units a day. That's the general trend that we go by here at our clinic. We also give them Juice Plus. We feel very strongly that the children's and family health programs that have been conducted for many, many years through Juice Plus and the surveys they have done have actually reported that there's less days missed of school, less doctor visits, less allergy manifestations, better lifestyle, water, and dietary intake with the whole educational dietary program of the Juice Plus gummies and capsules they have for the children. This is just the nutrient densities of fruits, vegetables, and berries that are concentrated and given in the form of Juice Plus, which we recommend. The fruits and vegetables are given to the children as a gummy. And the children really like this and seem to do quite well. And we've had millions all over the world use this. And we see consistent findings throughout all socioeconomic and ethnic backgrounds. So we find that very valuable. So if they're taking something like that has been shown on independent studies to improve their lymphocyte count, their immune white blood cell counts, checking their vitamin D, doing healthy eating, avoiding the sugary junk foods, drinking water instead of juicy drinks full of sugar. And if they are taking that with their D and Juice Plus, typically that's about all they really, really need. And then you have the Argentine Silver in a spray or liquid or dropper to be also quite helpful. And that's about all we do. Now, we do have a junior dehyst. This is natural quercetin, and the children can take that for allergies. And then we would ask you to find out what their blood types are. If they're blood type A, as a child, they can start getting a supportive digestive enzyme or what is that? Apple cider vinegar with a meal and help digestion, and that will help support them building a healthy body. So that's what we do here, Pat. Hopefully that was helpful. Next, Cynthia. Cynthia says, most of our foods and beverages are packaged in plastic these days. What is the effect of plastic around our foods, and what can we do? I read the summary of a study, or I read the summary of a study, that plastic molecules were found in mother's breast milk. Thank you. Well, indeed, microplastics and BPA and phthalates are very much seen in the lining of even the tin cans and the packages. Very often you'll see these packages in lunch meals and so forth. And we like to keep away from that. And the same goes for aluminum foil. I don't cook with aluminum foil. So you have to make an effort to have these plastics out of your life and learn to use good old-fashioned glass cups, glass plates, not using styrofoam cups, not using the plastic cellophanes and stuff that are wrapping our foods in. Get healthy containers and lids and reduce the waste from this. I like the concept of having dried concentrated paper for the washing machine. I think it's called Earth Breeze I'm using right now, so we can get away from all the plastic bottles and stuff. But indeed, phthalates and BPA biphenyls are associated with hormone disruption in these children and may aggravate normal endocrine development in the children as well. So please, yes, set the example by avoiding it yourself. Have a glass cup in your home and drink out of glass or a nice big glass jar. And one of my dear patients just brought in a gift for me. And look at this cute item here. It is a pitcher, and the cup fits on the top like that for my water. I just got that, so I'm going to wash it, and I want to thank you very much for that. And I will keep on filling my cup up, even though I have my water machines and stuff here. Okay, now let's see. Hopefully that is a response, Cynthia, for you. Adele says, a nice statement, Dr. Rita, what would you suggest for someone with low red blood cells and low platelets? Well, many things come into thought here. Are we talking about a child? Are we talking about a certain ethnic group? I mean, if the person is Black and has sickle cell anemia, they can have challenges. So many things come into thought. Are they a stressed executive working in a business with an ulcer? Do they have lots of colds and viruses? And your platelets will go down. Typically, a viral infection can either make the platelets drop or they can make the platelets go up, depending on what point in the exposure and measuring time you have. So platelets are a factor involved in preventing acute bleeds and so forth. And when there's any microtrauma, even from a virus or bacteria or infection, these are then triggered, and you can get variations in your platelet counts. You can have toxins that are damaging your bone marrow that help produce the platelets and the blood cells. So you have to, be thinking about the various blood dyscrasias and blood cancers. And menstruating women tend to have the low, normal, or lower red blood cell counts, because if they're not producing enough red blood cells at the rate at which they cycle and menstruate, then they'll have a net negative amount. If they are a vegetarian and not getting enough iron in them, they may not have enough if they're not eating enough healthy proteins to help make the cell, and the healthy fats to make the cell membrane, because the cell membrane is made of fat and protein. So much goes into that question. So you need to see your doctor. You need to make sure none of these more serious concerns are a part of the diagnostic concern. But the vast, vast majority are just iron deficiencies due to lack of eating enough iron, absorbing enough iron, or having a menstrual cycle that's heavier than your rate of production. And you need to always be looking for the common ulcer or a bleeding, gastrointestinal bleed, things such as this, Adele. Jenna says, Camilla Fiore at Forum Healthcare, formerly Great Smokies Medical Center in Asheville. Oh, I didn't know they changed their name. So Camilla Fiore, F-O-I-R-E, at Forum Healthcare, which I used to work at Great Smokies Medical Center in Asheville, increased my bioidentical progesterone from 50 milligrams a day to 100. That sounds reasonable. I also take 5 milligrams of DHEA. That sounds reasonable. And 30 milligrams of pregnenolone daily. That sounds good. In a ZRT, that's I think a Zeba. No, who was that did that original study? ZRT lab saliva tests. I used to work in the 90s to help do some clinical testing for these salivary tests. My estradiol was only 1.2 picograms per milliliter, which is low, because I am 55 and going through menopause. She recommended that I get a transvaginal ultrasound to see the thickness of my endometrial lining before adding any estradiol or estriol. Do you agree? We usually don't do the ultrasound beforehand unless there's some irregular bleeding or history of fibroids or a pelvic exam that shows an enlarged uterus. We normally start natural bioidentical hormones without an ultrasound, but there's nothing wrong with getting it. That's being very conservative. I am sleeping well and not having any issues. Well, over time, if you're 55, typically when the estradiol drops off, then you're going to start having less depth of sleep. It'll be more irritable, and you'll sleep more lightly, and you don't heal as well if you keep on waking up. Then your bone density diminishes, and your skin sags, your memory declines, even your immune system and many other systems decline. So I am in favor of natural hormone replacement, and I would like to see an estradiol of at least somewhere in the range of 50 picograms per milliliter. All right, let's see. My homocysteine was on the high end at 13. You should need to know your blood type and find out if you're an A. A's as a class generally don't digest and produce enough B12 due to lack of acid and intrinsic factor in the stomach. Without B12, you're going to have a high homocysteine. But all of us, as we age, we make less acid and intrinsic factors. So the older you get, we all need extra vitamin B complex as well, so we can help our metabolism. She told me to do 5 sprays of methyl B12, so that's right. Uh, and that sounds reasonable. My TSH was 3.5. That's average. Not now, but in the future, she suggests I check my TPO, thyroid peroxidase antibodies, and my thyroglobulins. I think that's reasonable. She said if they were elevated, iodine therapy would make it worse. I've never seen that to be so. We've been doing that for decades, and I've never seen iodine therapy aggravating thyroid peroxidase or thyroglobulin antibody production. If not, iodine is good. So have her check it, but I would have her check your 24-hour urine iodine with a test. She recommended for me now 2 drops per week of potassium iodine in water or rub on my breast. Do you agree? That's reasonable, but I think it's low dose. Is there a big difference in testing hormone levels through blood work or saliva? I've always found that menopausal women don't give pure salivary samples. Unless the technology has significantly improved from the time I used to do salivary testing. When you get into your 50s, 60s, 70s, 80s, and 90s, your gums are receding and you get much more likelihood of chronic inflammation at the gum line there, whether you see it or not. And then when you try and produce a salivary sample for testing, it can be inadvertently contaminated with a red blood cell, and that will offset the results and give you false readings. So I never found it reliable, so I stuck with the consistent known sourcing using serum and blood samples. She prefers saliva. Well, there is no formal guidance on this. It's just my 40 plus years of experience. So I have learned not to trust my salivary testing over these many decades. So I use the serum. So the ZRT test is 277. I can't afford that on a regular basis. Yeah, so stick with the serum levels, and hopefully that works. And we transcribe the results of these conversations. And so if you go back to the website tlcdoctors.com, go to the blog, you'll see the transcript, and you can let Dr. Fiore, Camilo Fiore, see my response, and she can contact me here at Tustin Longevity Center, 714-544-1521, and we can maybe have a conversation. All right, Tara has the next question. Hi, Dr. Rita. My question is regarding concussions. I had 3 in 10 months in 2020. They were mild, but now I'm still very sensitive to any movement. Car bumps, hard braking, anything that jostles the brain. It's like a state of intoxication without being intoxicated. Have you seen this before, and what do you recommend to heal the brain? I also have concurrent gadolinium toxicity. I've been treating it with EDTA. Very good. I feel like the concussions and heavy metals have a correlation in healing and symptoms. Many thanks and God bless. Yes, Tara. There is a whole subspecialty in sports medicine on children and high school and college, and then professional football players who go through their life with multiple undiagnosed mild concussions and a syndrome of cognitive deficits, neurological symptomology like you're describing can emerge. Now, your age matters. So if you're very young and this is happening, it's less of a concern. The older you get, it's more of a concern. I presume you have a doctor who has done a neurological exam on you, who knows your history, any other drugs that you may be on as well, and who has decided whether or not a CT of the head or MRI of the brain should be done or is indicated, a neurological consultation also. Another thing is you can also see many of these symptoms with heavy metal toxicity and gadolinium. Unfortunately, gadolinium is used to infuse the contrast for some of these imaging. But the good news is EDTA chelation will eventually pull this out if you continue to do this on a regular basis and compare it. So you need to see your doctor. You need to have them follow you for some of these concerns. I'm so happy to hear you're doing EDTA chelation. Now, if you're older, very often we start to get what we call vertigo or benign positional vertigo. There are little otoliths that are in our loops of Helene in our ears. These otoliths can get stuck instead of rolling with our head in its various positions forward and back. These little markers and the flow dynamic of the fluid in these loops that feeds back to us, our proprioception position of our head, can also be aggravated, and that could be a complicating factor too. So having that addressed for vertigo would be something else that you could think about. So yes, we do see these things. Yes, they tend to heal, especially if you eat a healthy. Remember, your brain is mostly fat. The cell membranes are more like 75% fat, 25% protein. So it's important to eat a healthy linoleic, alpha-linoleic acid content, and that's found in healthy meats, the skin of the chicken and the chicken meat. It's found in egg yolks. It's found in nuts and seeds. It's found in your fish. So you have to eat a robust amount of protein, 70 grams a day. You have to digest it well. If your blood type is A or you're very much older, you need help with digestion to extract them, to repair your brain. The EDTA chelation will help you with your microcirculation to get those repair molecules to your brain surface. Gradual physical therapy, exercise is also there. And then there are neurologists, there are physical therapists, there are subspecialties in chiropractic and body mechanics that work with post-concussive syndrome, where they work with you in physical therapy to get you into a better state of health. So all these things are important. Debbie asks, hi, Dr. Rita, how does the colloidal silver mechanism work to kill bacteria in the human body and viruses? Also, are there any human studies to show this? Blessings and thank you. Yes, there are many studies, many animal studies on the mostly in vitro, meaning in the cell tissue, both from human extracts, human lymphocytes, and then the animal studies. Silver is taken up typically by the bacterium and fungi and virus in the cell lymphocytes as well, and they mess up, so to say, the replication of the viral impact. If it is a virus, they mess up the bacterial internal components, internal cellular organelles. And so, yeah, there's a robust field of science behind this. So the silver has been used for thousands of years, and mankind has learned that silver inhibits bacteria and viral and fungal issues. It's been used by all the royal peoples who could afford silverware and drink out of silver cups and so forth. So it's a part of destroying the uptake and the intracellular action of some of these pathogens. So yeah, it's been studied in humans and in animals. Let's see, the next page is, Brenda, what do you recommend for leaky gut? Well, that's an entire course. Leaky gut is basically seeing if this is a cell membrane right here in this picture and it's healthy, and over here it shows this blowout, this break through the cell membrane. And remember, the cell membrane is a double layer of phospholipids, 50% fat, 50% protein. And so when you go inside through the gut and swallow something, the thickness is only one cell membrane, that little membrane thick. And if you have a lectin, a toxin, a bacterium, a parasite, heavy metals, all these various things that can irritate a food allergy lectin and can kind of sort of scratch the tube as it's going down, it pokes a hole, and then material inside the gut can go into the lymph system and into the body where it's never supposed to go. Therefore, your body will immune respond to this and develop a inflammatory response. If you keep on eating the same food allergen, drinking the same, heavy metal, toxic laden material, it'll keep these holes being poked. And if you don't eat a healthy diet of healthy proteins and fats, you're not going to repair it. And so leaky gut represents the culmination of lifestyle, food allergies, heavy metal toxins, glyphosate, genetic modified food irritation, heavy metals, bacteria, viruses, fungi, parasites, on and on, that create these damages. And your immune system responds to it very often. Then we link this with autoimmune reactions, whether you're more destined to get rheumatoid arthritis, juvenile arthritis. It could lead possibly and be linked and associated with multiple sclerosis, other neurological problems. So thyroiditis is very, very common. So leaky gut then means you have to fix it. So we do a food allergy test to see what foods you're reacting to, and we ask you to eliminate those. And you stay away from them. And then we give you in a diet, typically we give you phospholipids, which make up the majority of the fat. And then we give you proteins, immunoglobulins, which are protein and natural antibodies that normally populate the saliva. And these immunoglobulins and protein help repair it along with the phospholipid fats. The products I use from Orthomolecular are NT powder or BioPC Pro, which are two different phospholipid powder products from two different companies. And we take a scoop of it, and then we take it with the other orthomolecular product for the protein and immunoglobulin, which is SBI Protect, which is serum bovine immunoglobulin from, I think they are from New Zealand, grass-fed cows, and those immunoglobulins you ingest. So then if you take that, a scoop of that in water of the immunoglobulin protein powder and a scoop of the phospholipids in water, and you drink that first thing in the morning, it tends to help plug these holes in here. And then if you're eating a very healthy diet that is naturally also rich in these things, and you restrict your eating time to a 6-hour zone, then you're only using the stomach and presenting it with work to do, and the food selection, food components during that 6 hours, and you give 18 hours of it to heal, then you tend to have more time healing than you do time where your stomach is being used for work and exposure to further potential irritation and damage. So you're narrowing down through food allergy avoidance, and we call this a simple one menu rotational diet. So you would make your eating in that 6 hours only of one protein, one vegetable, maybe one type of berry and one nut. And you eat that throughout those 6 hours. You don't change your menu. So there's really only 4 items that your gut has to deal with: chicken, green beans, walnuts, and let's say blueberries. And then you eat that for the 6 hours. And then the next day you change it to beef and broccoli and pecans and strawberries, let's say. Given you didn't have any problem with the food allergy test identifying these randomly selected healthy foods that are grass-fed, wild-caught, organic. Then the third day, maybe you could have salmon and asparagus and macadamia nuts, and you could have blueberries or blackberries. And the fourth day, you could have maybe pork and sunflower seeds and spinach and raspberries. You see what I'm saying? So you have a very simple set menu during those 6 hours, and you nibble off of that. Condiments, we allow butter, real raw wild butter, and salt, and some pepper. Some people can handle pepper, but salt should be enough. So the less you present your gut with, the better and quicker you're going to heal your leaky gut. The more limited hours consistently and the more time you allow for healing, 18 hours or more, then your gut will heal quicker. If you use the NT powder or BioPC Plus powder, or and rather mix it with the SBI Protect, which is the protein immunoglobulin powder, to begin your day and the last thing you do at night, then you're going to probably do very, very well. Plus, we always usually give vitamin D, and we give a good B vitamin, and we give a multi-mineral. Those are the bare minimums that we use. So that's our general approach to leaky gut treatment. Pamela asks, besides less sugar and carbohydrates, what would be your best advice for people who have had reactivation of eczema after many years and or a new autoimmune diagnosis shortly after COVID booster? Well, I would do exactly what I said for Brenda on what I recommend for a leaky gut. That's exactly how I do it. But I would add systemic enzymes morning and evening on an empty stomach. I would take Vascuzyme put out by Orthomolecular or Vitalzyme. I would take 5 or 6 twice a day on an empty stomach to help prevent microclotting and to chew up antibody antigen irritants in your body. I also would try and get in EDTA chelation therapy to improve microcirculation and to detox. Remember, it's been described that the protein spike is a cation, meaning it's got a positive net charge, the spike protein, and EDTA chelation is negative, an anion, and it tends to take out that spike protein based on the pharmacokinetics of both the pathogen of the spike protein and the knowledge of EDTA chelation and how it works. Vivian asks 2 questions. First question, I recently had COVID. I had a temperature of 100.5 for about 6 hours. Then it went back down to 99 and then normal within just a couple of hours. I understand that with COVID can come hair loss. Any stress can produce hair loss, really. Is there anything you can recommend that would help me to circumvent that? Or if I do start having hair loss, what are certain supplements that I could take to counteract and to encourage regrowth? Actually, at the onset of any insult, ice caps, if you put them on your head, it helps prevent the inflammatory response to the scalp blood vessels. But eating a healthy protein diet, taking systemic enzymes reduces inflammation, like the Vascuzyme and the or Vitalzyme, on an empty stomach. But you have to take a good amount. You have to take at least 5 twice a day for several weeks until you're totally disinflamed for the event. Drinking plenty of water, always EDTA chelation, improves the microcirculation to your skin and your scalp and such. Getting a good night's sleep, and not eating late, eating in that time restricted zone. So it's 6:40 right now. So when I go home after this, I should not eat at all. And I should just wait till tomorrow at 1 o'clock when I can have my next meal. And that's what I generally try to do, and essentially eat a 1 meal a day. So eating in a time restricted zone, taking systemic enzymes, drinking plenty of water, all towards disinflammation. Ice caps do work with acute inflammatory responses. Her second question is, I have a hard time with acid reflux. I'm currently taking pantoprazole. She's not sure. That's a something like a Nexium or a omeprazole. Things like this are H2 blockers. I really don't like having to take medication long term. Are there supplements that I could take, natural supplements that would reduce my inflammation? I really can't stand the acid reflux. It happens all the time, and if I don't take that medication, and I can't enjoy eating food because I know what I'm going to experience soon after. Thank you very much for your consideration. Merry Christmas. Yes, Vivian, again, you have to stop eating at 6 o'clock. You have to find out your blood type. If you're older than, 50, 55, you may be having, even if you're not a blood type A, you might not be digesting as well as when you were a teen and 20s, 30s, 40s. And you might need help with your dinner digestion. So you would take a digestive enzyme with betaine hydrochloric acid. I take 5 after every dinner meal, and I'm a B type blood. And that is what has helped me with my reflux. Never lay down after going to bed. After dinner, wait for 3 or 4 hours. And it can really take 4 hours for your stomach to empty, and it takes longer the older you get. I'm always telling my older patients to try and stop eating by 6 o'clock for sure. Many of my older patients really eat between 4:30 and 5:30 and use their digestive enzymes, and that tends to be very helpful. If you're blood type A, you'll probably need digestive enzymes with every meal. A walk after dinner also facilitates that, not laying down. These are very important, helpful things. The very same thing that helps repair the cell membrane in your gut and the esophagus there, that gets the irritation from the gastric sac burped up into the esophagus, where you get those symptoms transmitted. If you take the SBI Protect powder with NT powder, that's very, very helpful morning and evening. You can use dosings of glutagenics or L-glutamine, GlutaShield. These are glutamine amino acid rich concoctions. Some of them have licorice in it, some of them don't. And they're very helpful to be used as natural antacids. But that's sort of the beginning of where I would go with Vivian. Rhonda asks, do you recommend anything to lengthen our telomeres? Well, what I really recommend for that are all the things that we normally talk about, is our lifestyle disciplines. Getting to bed reasonably early, not staying up till 11, 12, 1 a.m. And because most of your healing, the signals, wherever the sun is, when it's 9 o'clock, wherever you're living on the planet, at 9 o'clock, the electromagnetic energies are such that It's trying to tell your pineal gland, calm down, all the animals are getting bedded down, and you will release somatostatins, growth hormone, repair hormones, healing hormones in your own body. If you're not going to bed at 9:30 the latest, you're going to miss the secretion of this. And if you live a lifestyle like that, you'll age more quickly. If you don't drink enough water, you won't keep your telomeres long enough. If you don't have a regular exercise program, if you eat a high carbohydrate diet, it will clog up your capillaries and create oxidative stress at the very distal end where that tiny, tiny capillary gets plugged. If you eat junk food and don't eat the things you're made of to repair, even the lack of good bacteria and your own body's production of butyrate, short chain fatty acids that help protect the DNA and the telomeres. So we recommend a style of life, all those things, probiotics, vitamin D, EDTA chelation for circulation, plenty of water, exercise, not staying up late. We do believe in early to bed, early to rise. So those are all the things. As far as a supplement, I'm going to say that I am not impressed with any one supplement being recommended, but I am going to stand out and make a recommendation for Juice Plus. I have seen over almost 25 years now, a quarter of a century, those patients who have taken Juice Plus consistently seem to have reduced their DNA damage, and the end of their DNA is where the telomeres are. So if it's a double strand like that and it's got like a cap on it, like the end of a shoelace has a cap on it, those DNA strands are protected, and it's well proven. There are studies on DNA at universities on Juice Plus. So it's the most researched nutraceutical. So if I were to stand out and say, what one nutraceutical can I really see science and then actual clinical evidence, and I'm going to say it's the Juice Plus. So hopefully that helps. Ariel says, can EDTA be applied topically as a cream? My husband won't use the suppositories of EDTA. I have seen many decades ago that they were using topical EDTA on children who had autism. And these toddlers and young children, would not be still for an IV or anything like that. And I saw credible science on the topical application of EDTA in these children. Now, I've never seen it in the adult. I've never seen studies on that. It's a large molecule, and I can't see it being absorbed in the older skin layers of the grown adults. In the young children, with their very rapid growth and supple skin, I can see a better likelihood of it being absorbed. So I think that's a long shot. Michelle says, do you treat for possible adverse side effects from vaccines? Well, we treat anything. We try to help everyone. And if you use basic core principles to improve your circulation, if you take certain core nutrients and nutraceuticals as well as pharmaceuticals, remember EDTA is a prescription FDA approved medication. These are what we found, along with enzymes, that seem to be overwhelmingly protective, as all my patients have done marvelously well, even those who had received the mRNA injection and they had events. They had been using the EDTA chelation. They had been using the systemic enzymes. They had been drinking plenty of water and trying to reduce their sticky carb lifestyles, and they survived events, and I believe that's totally because everything we had been doing. All right, so that covers the emailed questions. Let's try and get to some of those that were put in on the chat here. And if this information is helpful to you folks and valuable, I would certainly ask you to please like and subscribe and share this with your family and friends, and remind them that they can look on the TLC Doctors, plural, tlcdoctors.com, and go to the blog, and they can look at some of the transcripts there, so they don't have to listen to the whole thing. They can maybe look at a question that is of interest to them. So thank you for liking and subscribing. Now let's see here. We had the first question is from Dolphin. Can EDTA be a cream? I think I already answered that. Yeah. And Dolphin says, do you recommend nicotine for nerve damage from the jabs? I would have to say I have limited knowledge, Dolphin, on the association between nicotine and neuropathies, nerve damage, complaints, pathology. And I would have to defer on that and try and look into it later. Let me write myself a note. Nicotine and neuropathy. Okay. All right. So maybe next week I'll have an answer and you can re-ask the question. Dolphin goes on with the third question. Dr. Brian Artis has been mentioning snake venom that's shedding onto us who didn't even get the jab. I've heard of him. He's a chiropractic physician, and there are, associations with the neurotoxic and the blood reaction of their venom that is also associated with some of the proposed mechanisms of damage of the spike protein. And so I can understand some of his logic. And so I'm neither endorsing nor denying what he's saying. The good news is by taking EDTA chelation, using systemic enzymes, drinking plenty of water, low-carb diet, regular exercise, a good night's sleep, eating a healthy diet of cell membrane, endothelial lining of all our vasculature. Notice I'm here every day at roughly 70 years old of age. Every day of my life I'm here, and I'm touching and with people. A goodly portion of some of the patients I see have had the vaccine, so I have regular contact. I'm doing quite well. And so I want to stop any fear-mongering and concern, and I want to say we all should do quite well if we're following healthy, God-given lifestyle things that we can all do. So that's what I have to say on that. And she reports, any advice? I just gave my advice. My husband got essential tremors after getting both jabs. I'm sorry, that's unfortunate, but I do think that if he's seen by a good functional integrative doctor who is licensed to practice medicine, naturopath or doctor of osteopathy, who does chelation therapy, uses these instructions and a very good enzyme such as Vitalzyme, Vascuzyme, but at least 5 twice a day on an empty stomach with these lifestyles that I've recommended in the above questions. It should be of great value and help to him. Wendy goes on to say, hi, doctor. Is there a reason for mucus in the stool? All blood work was great in summer. It's increased a lot over the last year. She goes on to say, is this something to worry about? Mucus is normally produced when there's an irritant. The mucin in the goblet cells and the lining of the gastrointestinal system is a way of distancing irritants there. So I would have some concern. I would certainly see your healthcare provider and find out when your last colonoscopy, if ever, or what your age is, and are you due for it? Is there a family history of you having colon disease, colon cancer in close, immediate family relatives? If all the colonoscopy was benign or you're not old enough to recommend that, or there's no family history at risk, then find out your blood type, because very often food allergies, these chronic irritants, can be associated with increased mucus production. I would go to a doctor who could do some food allergy testing, looking for the lectin responses. If you took that SBI Protect and the NT powder, or the other product called Bio PC Pro, those are the phospholipids. NT powder and Bio PC Pro are NT powders. They're equal products. I like the Bio Pro PC powder better than the NT powder now. It just doesn't clump as much. And that tends to help the lining of the gut. So I would avoid food allergies. Typically, the genetic modified foods need to be avoided. Most of all the legumes and soybeans and the corn and the wheat products should all be avoided. Pasteurized, homogenized dairy should be avoided. So if you eat primarily grass-fed, wild, pasture-raised meats, fish, poultry, and such, along with organic cooked vegetables. Cooked tends to be more healing than raw. Raw tends to be more irritating. And simple spices like butter and salt, and do that on a rotation basis like I described in the very first question of today. Then you should see the mucus immediately recede. But if it doesn't, please do see your healthcare provider. Rosa says, Dr. Rita, mom is 96 years old, was diagnosed with COVID, and PNA started, I think that's Paxlovid, started Ivermectin today. Oh, a physician assistant started Ivermectin today. Okay. 1 week after the diagnosis. Usually we like to start it in the first 3 to 4 days. Should we add hydroxychloroquine? Symptoms, she's very sleepy and doesn't want to eat or drink. Thank you. Well, I'm not there to see her. I don't know her background. I don't know what other medication she's on. And she's in a very older age and frail. So in general, the ivermectin, if appropriately dosed along with vitamin D, zinc, 25 to 50 milligrams a day, vitamin C, like 500 milligrams 4 times a day. The vitamin D, I would probably take a 50,000 international unit, 1 a day for 5 days for my elderly patients. And I would consider lots of broth and fluid volume. If she's able to eat, she could have some chicken broth, beef broth, and give her easier things that are nutrient dense, like you can maybe puree some beef and puree some vegetables, and make sure she's getting enough protein and fats for that. I would certainly ask her to stay away from the sugars that are immunosuppressants. But it sounds like she's under good care, and hopefully she's getting at least 0.4 milligram per kilogram dosing. And that would be somewhere in the realm of, depending on most women, if she's a typical woman and not obese, anywhere from 12 to 18 milligrams once a day for 7 days should be very good. But those are the general things and nutrients that are recommended. What do you think of a mass gainer supplement for daughter who is 26 and struggling to gain weight? I'm not familiar with that term, a mass gainer supplement. So I do not know, what you're referring to there, Rosa. So I'm going to have to say, this is something you'd have to have your daughter who is 26 see a physician who is, licensed to practice medicine. Make sure there aren't any other issues that are going on. Make sure she's not having diarrhea, vomiting, or that she has hidden bulimia or eating disorders. Making sure that she isn't having metabolic problems, blood sugar problems, and go through that workup first before you start talking about dietary. You got to know your blood type too. A's don't digest as well, so they can't absorb as well. Those are various things, but this is something that needs to be seen, by your doctor, and have that managed. Hopefully, the doctor has a good foundation in nutrition and functional medicine. Deborah says, I have a Christmas joke. Okay. What happens if you eat Christmas decorations? You get tinselitis. Ho, ho, ho. All right, tinselitis. That's cute. I remember putting up tinsel that was like those little aluminum strands hanging on the branches, and it would look like it was a weeping willow with all that on there. So if you eat Christmas decorations, you get tinselitis. Okay. Thank you, Deborah. Uh, Ratatiti. I take a shower every morning and I work out almost every day. At night, and I only sweat a little bit. Should I take a shower in the morning and after? Let me read this. And a shower in the morning and after workout, or only in the morning? I am against showering excessively, especially if you're older. The skin, the thickness, the fats that are in the lining of your cell membranes are going to get dried out. You'll wrinkle, you'll age. Your ability to handle that is aggravated with aging. So I'm for getting good old washcloths and just washing in the areas that produce bacteria, and that would be your armpits and your groin and your feet. So I would definitely not shower as often. And I'm a 14-year-old. Oh, okay. So as a 14-year-old, I would probably say that's not as important then. And whether you shower, I would probably not use hot water. I would try and use as cold a water as possible. And I would only put the soap to the armpits, the groin, and the feet. I'd get in and out to get rinsed off. But that would be my answer to that. Let's see if there's any other questions. It doesn't look like it, and we're pretty much on time. It's 7:03, so I'm going to go home. I've had a long, long day here since 8, and really no break whatsoever. Reminds me of my emergency room days. I want to thank everyone for coming, all you TLC Health Freedom Tribe people, and we will see you next week on the 20th. And or what is next week? Next week would be, yeah, it's the 20th. You're right. Okay, so I'll see you all next week, and we will go from there and take your questions. You can type them in. Look at the link down here if you are on YouTube, and you can type it in the chat area here. And so may God bless and keep you all well, and love your neighbor as yourself, and love God, and read your Bibles, folks. Okay. All right. God bless and good night from Tustin Longevity Center and all our staff. God bless. Bye-bye.